Hi, my name's Dr. Jonathan Irish. I'm a head and neck surgical oncologist at the Princess Margaret Cancer Centre in Toronto, Canada. I'm head of the Division of Head and Neck Surgical Oncology and Reconstructive Surgery at the University of Toronto. Well, the risk factors are very dependent on the location or site of the cancer. But the most common risk factors, and this is true of all of the sites in the head and neck, are tobacco use, including smokeless tobacco and chewing tobacco, as well as chewing pon or the betel nut quid. Alcohol use, especially combined with tobacco use, is also an important risk factor. Some sites of cancer of the head and neck have more specific risk factors. For example, infection with a virus like the human papilloma virus or HPV, particularly is a risk factor for oropharyngeal cancer. That's cancer of the back of the tongue or of the tonsil. Other risk factors, exposure to radiation, exposure to wood dust, asbestos, and certain synthetic fibers or toxins for cancers of the sinuses, Epstein-Barr virus, and genetic causes, or currently living, or where one's ancestry may be from Southeast Asia, is a recognized risk factor for nasopharyngeal cancer. More rarely, genetic diseases can raise the risk of squamous cell carcinoma of the head and neck, Fanconi anemia, for example, which is a deficiency in DNA repair. Some patients presenting with head and neck cancer have no obvious risk factors that would predispose them to this cancer. Prevention of cancer is therefore largely related to alteration in lifestyle, stopping smoking, stopping smokeless tobacco use, refraining from using the betel nut quid, refraining from or moderation of alcohol use. All of those are significant lifestyle changes that one can make to prevent and mitigate the development of head and neck cancer.